If you look at Johns Hopkins's will, it specifically states that, now it's a fairly Baltimore-centric will, but it specifically highlights that one of the missions and one of the purposes of the hospital and the school he created was to educate people to a very high level and to create a hospital that would care for people from all walks of life. He was always interested in the welfare of others, and I think he would be very proud of what we're doing internationally to elevate the quality of healthcare outside of Baltimore, outside of Maryland, outside of the United States. So between 2003 and 2008, I and a lot of other people created a brand new curriculum for the Johns Hopkins School of Medicine called Genes to Society. And David Nichols and I were very interested to see if that same curriculum that we were going to deploy at Johns Hopkins would have relevancy outside of Baltimore itself. They found a group in Malaysia that wanted to create a brand new medical school based on the US model, which is, there is no other school on that model in Malaysia, and utilizing the Gene Society curriculum. And they asked me to go out there and be the founding dean and to set up that school. So I knew Johns Hopkins Medicine International a little bit prior to then, mostly by either taking care of patients who they had brought to the United States or on a couple of occasions going abroad and helping to take care of patients. But what I was not aware of to any really substantial degree was the level and the breadth upon which Johns Hopkins Medicine International touched Johns Hopkins Medicine in places outside of direct clinical care. My preparation at Hopkins, the values I had spent at that point, 25 years learning at Hopkins about excellence and collegiality and integrity and patient-centered thinking, patient-centered education, all of those things prepared me well, because it turns out that the rest of the world really does want to take good care of patients, and patients want good care. That's not simply a Baltimore-centered belief. That is a value that is present throughout the world. The only question is whether or not there are the opportunities for the patients and for the learners to have that kind of patient care and that kind of education. For a lot of reasons, having a diverse workforce at Johns Hopkins Medicine International is vital to our success. What we find and what I love about Johns Hopkins Medicine International, the people I work with here, is that there are so many interesting, fascinating people with remarkable stories. And they bring those stories to our patients who come in, they bring those stories to our clients that we service overseas, and I'm certain that the diversity of how our staff is constituted makes us a better and a more functional organization, and for me, it certainly makes it a more fun place to work.